Hi, my name is Nobie Mitchell. I am a Georgia SHIP counselor. I will be speaking with you regarding Preventative Services Part 4, diabetes, hepatitis, and more. Medicare has several parts: Part A, Part B, Part C, and Part D. And when you are in need of specific services, it can be lots to learn and consider. Medicare Part B medical insurance covers many preventative health care services to prevent illness like the flu or detect any illness at an early stage that is completely free for you. What services does Medicare Part B covers for diabetes? Diabetes screening. Medicare Part B covers blood glucose, blood sugar, laboratory screening tests with or without a carbohydrate challenge if your doctor determines you're at risk for developing diabetes. You may be eligible for up to 2 screenings per year. Medicare Diabetes Prevention Program. Medicare covers the Medicare Diabetes Prevention Program once in your lifetime, and in all these conditions apply to you. You have Medicare Part B or a Medicare Advantage plan. Hemoglobin A1C tests result between 5.7 and 6.4%. Fasting plasma glucose of 110 to 125 milligram/DL, 2-hour plasma glucose of 140-99 milligram/DL, oral glucose tolerant test. You may have a body mass index, BMI, of 25 or more, BMI of 23 or more if you're Asian. You have no history of type 1 or type 2 diabetes. You've never been diagnosed with end-stage renal disease, ESRD. You've never participated in the Medicare Diabetes Prevention Program. Diabetes self-management training. Medicare Part B medical insurance covers outpatient diabetes self-management training if you've been diagnosed with diabetes. Medicare may cover up to 10 hours of this initial training, 1 hour of individual training, and 9 hours of group training. You may also qualify for up to 2 hours of follow-up training in each calendar year that falls after the year you got your initial training. After you meet the Part B deductible, you pay 20%. What other services does Part B cover? Glaucoma tests. Medicare Part B medical insurance covers glaucoma tests once every 12 months if you're at high risk for developing eye disease glaucoma. After you meet the Part B deductible, you pay 20% of the Medicare approved amount, and in a hospital outpatient setting, you also pay a copayment. HIV screenings. Medicare Part B covers an HIV, human immunodeficiency virus screening once every year if you meet one of these conditions. You're age 15 to 65. You're younger than 15 or older than 65, and you're at high risk for HIV. If you're pregnant, you can get the screening up to 3 times during your pregnancy. hepatitis B virus, HBV infection screening. Medicare covers an HBV screening if your primary care doctor orders one and you meet one of these conditions. You're at high risk for HBV infection, or you're pregnant. Hepatitis C screening test. Medicare covers a hepatitis C screening test if your primary care doctor or other healthcare provider orders one and you meet one or more of these conditions. You're at high risk because you have or use illicit injection drugs. You had a blood transfusion before 1992. You were born between 1945 and 1965. If you were born between 1945 to 1965 and aren't considered high risk, Medicare pays for a screening test once. If you're at high risk, for example, you've continued to use illicit injection drugs since your previous negative hepatitis B screening test, Medicare covers yearly screening. If you need assistance with your Part B plan or have any questions concerning the type of coverage you will receive through Part B, please call Three Rivers Area Agency on Aging, Georgia SHIP Counselor Belinda Meadows at 678-552-2839 or call 1-866-552-4464 and select option 4 to speak to a certified Medicare SHIP counselor. Thank you.